Hello, welcome back to Mind Matters with Dr. Gochukwu Ojiako. So last time we discussed bipolar disorder, its presentation, risk factors, causes, demographics, prevention, diagnostic criteria, and treatment. So today we will be discussing grief and bereavement. Grief and bereavement involve a wide range of normal responses that can become abnormal or excessive. They involve normal, cognitive, emotional, and behavioral responses or reactions to the loss of a significant person or an object. They can also involve abnormal psychological responses to an identifiable stressor that can lead to clinically significant emotional and behavioral symptoms. The type of stressors that can lead to grief and bereavement include loss of a relationship, loss of a partner or a relative, leaving home to college, becoming a parent, getting married, or retiring from a job. Usually, the stress associated with these stressors develop within 3 months of the stressor. Thorough assessment is needed to separate normal healthy grieving from pathological grieving, which may represent adjustment disorder or major depression. To differentiate normal grief or grieving from pathological grieving, the following must be considered: the severity of response to the stressor, the duration of response, and the effects of the response to daily functioning of the individual involved. It is also important to consider the individual's perception of the impact of the stressor. So when the severity or duration of grief is excessive, grief may be abnormal. In the absence of other clinically significant symptoms, grief may be classified as adjustment disorder. It can be adjustment disorder with depressed mood. It can be adjustment disorder with anxiety, adjustment disorder with mixed anxiety and depressed mood, or it can be adjustment disorder with disturbed conduct. It is important to know that unlike a major depressive disorder, self-esteem is preserved in a grieving person. Causes of grief include significant loss, limited coping skills, and limited social support. Demographics. Normal grief is actually universally experienced. Grief is more common in older adults as their social circle begins to decrease. According to research, 20% of individuals who lose their spouse develop grief within the first year of the loss. Research also shows that grief occurs in 50% of clients after a cardiac surgery. Prevention of grief involves asking about losses to identify at-risk individuals so that preventative counseling can be started. So this means that early recognition, intervention, and initiation of treatment are very, very essential. Assessment to diagnose grief involves asking about recent losses. And this is very important because people don't usually disclose their struggles with grief and bereavement unless directly asked. So it is important to ask about recent losses. Ask about anniversary dates of previous losses. Ask how the individual has dealt with losses in the past. You also want to ask about social support, functional impairment, anorexia, insomnia, suicidal thoughts, substance abuse, or denial. Physical assessment is non-specific for grief and bereavement. Mental status exam often shows depressed mood, anxious affect, tearfulness, or crying uncontrollably. Of course, diagnosis is non-specific. However, it is often essential to do basic labs like CBC, CMP, TSH, vitamins, of course, vitamin D and B12. Also, drug screening may be needed if indicated by history. So we want to do all these labs to rule out metabolic causes of the symptoms being experienced or reported. Risk factors involves limited social support, limited coping skills, and poor health. Treatment involves pharmacological and non-pharmacological treatment. Pharmacological treatment of grief usually involves use of anti-anxiety medications and use of sleep induction agents. Also, depending on the severity of the response, low-dose antidepressant may be added. It is essential to note grief can happen at any age. However, it is common in older adults due to cumulative effect. As they are getting older, they are losing friends. And over time, there may be a cumulative effect of these losses. Non-pharmacological treatment of grief involves educating the patient about grief responses and reactions, inquiring about losses, encouraging expression of grief and losses. You want to offer group therapy is very, very essential, community resources, psychoeducation about grief and bereavement. And if there is functional impairment, psychotherapy may be needed, such as CBT. Of course, follow-up of a grieving person involves close follow-up. During the acute phase of the loss, you want to follow up with the individual, maybe on a weekly basis. It is also essential to monitor the person for depression, because if grief is not addressed over time, it may lead to major depression. It is also very important to be sensitive to non-traditional losses that can also cause grief and bereavement, such as loss of a pet, loss of status at work, or even in school setting. In our future video, we will discuss the remaining type of mood disorder. Our email address is located in the description, so please feel free to send us your general questions. We will randomly select questions to be addressed in our future videos. So like, comment, subscribe, and please share this video with your friends and your families. Thank you for watching. I am Dr. Ogochukwu Ojiako. Thank you.